I personally think we're just scratching the surface, right? I think there's so many interesting things that are happening right now. If you look at, even just from the technology standpoint, like Biogen, patients like me, and Fitbit doing a whole test with MS patients in terms of their mobility, and kind of seeing like how just the innovative ways to see how patients are doing with progress of when they're taking medication is super interesting. But I think from social, that the connection will change medicine. I think anonymous data, however you look at it, that will absolutely 100% change medicine and save lives and cure disease. And the more we know about all the information, the faster that's going to happen.
Yeah, I agree. This is going to change medicine. The iPhone, the electronic patient, mobile health, the AliveCor. Anybody wants their EKG, I can trace your EKG through your fingertips through this device on my phone. It's all going to integrate wearables, sensors. All this data is going to allow us to be better at recruiting at clinical trials. 35% of all time and money spent on clinical trials is spent in recruitment, and over 35% of all sites never meet their recruitment numbers. This is going to change that, as long as the FDA helps us out and gives us guidance. But it's going to change it.
What do you see in the social space?
I think that this is going to be a great way to connect patients that are in a trial. You will have some unblinded things that will happen because people will talk, but it's a great way to create a chat around a trial that may be difficult to adhere to, and it may be a support group, just like if you had a pacemaker or defibrillator support group on Twitter, and you could say, it's really hard to take those pills. I don't know if they're placebo or if they're the real deal. We've got to do this together because it'll improve outcomes for other patients. I think it's support, it's engagement, and certainly recruitment. But we need guidance from the FDA.
Great. I'll go down the line. The future of IHadCancer.com, or anything else you think where future of social health is going?
What I would like to see, and I can't speak too much about it just because I don't know enough, but it's really with, I think, our electronic medical records. And I think that, I believe that there are a couple of companies working on trying to get something in place, but I think there needs to be one centralized location so that wherever I go, no matter what doctor I go to, they're all feeding off of the same information so that it's all in sync.
That's great. And on the physician side, from a Doximity platform, any future thoughts there?
Sure. So a couple things. I would say, like my colleagues have echoed, don't underestimate mobile. Today, over 2/3 of all activity going across Doximity is mobile, and that's well over half of all doctors using it. You can't even try to go down to the cell phone store here and find a dumb phone. You might be able to find one or two, but that'll be gone in a year.
Only if you're a drug dealer, I think, right?
No, they stopped using the burners a while ago. Yeah. The next thing is APIs. I think the opportunity for these platforms to connect with one another, Doximity has an API that's used by a lot of startups now, where we, despite being a 100-person company, don't have time to build it all. But we can help somebody else not reinvent the wheel. And the combination of APIs and the government opening new data sets can make it easier and easier to get other projects off the ground. And so I think that'll be particularly important. And then finally, culturally, I think we're going to start to see a flattening of the hierarchy. Medicine is probably the second biggest hierarchy in the world after the military, in terms of the yes sir, no sir to the person 1 year older than you. Not really a merit-based economy. And I think with the opportunity for folks to leapfrog in their discussions and not work their way up that particular food chain, we can actually identify the key opinion leaders before they ever become one in the future and help nurture them and help them come up with the next clinical trial that will end up saving or helping a patient population.